We are back and we are,
Lucky you.
we are continuing our conversation on endometriosis, and I just wanted to again give you a reminder that we are not medical professionals. This is purely based off our personal experience and any research that we have personally done ourselves. So
Take what you will. This is not necessarily advice, but it's just sharing what we do know.
Yeah.
In the hopes it might provide some comfort.
Yes, exactly. All right, so now that we have a better understanding of what endometriosis is, I'm going to continue on with some of my questions.
Amazing.
This is more around symptoms and why endometriosis is missed.
Yeah.
So, what are some of the most common symptoms that get normalized or brushed off?
So it's more, as we said in our last episode, they're very much aligned with bad period symptoms. So, but where endo's different is the level of that pain. So it's, severe period pain that actually stops you functioning. I have fainted before. I've been sent home from school before. I know a lot of women, get that lie? No one's lying. That low iron diagnosis. I've had a lot of infusions myself. Pain with sex is a big one. I thought that was normal.
Yeah.
Having a lot of discomfort and even bleeding.
And it can be, obviously, especially earlier on in your life.
But every time?
Yeah.
And bleeding for weeks after?
Yeah, that's not normal.
But I didn't, and it's not something you kind of prance into your doctor to talk about, is it?
No.
One thing that I found with myself and had no idea was endo-related was painful bowel movements, or particularly during your cycles, constipation and diarrhea.
Mm-hmm.
Talk about
Which is...
how does that work?
Yeah.
I know when I would be right in the middle of my cycle, I would have horrific toileting. Like it was just, I was bouncing between gastro stop and coloxal.
Yeah.
Like my poor body can't make its mind up. Blood in the stool is also something that's really overlooked, and that's why they went down the path of colonoscopies and endoscopies for me, because that's a symptom of bowel polyps.
Yeah.
But if endo is growing on your bowel and you have lesions on your bowel, when you have those movements and they bleed, explains a lot. The famous endo belly. It's why I'm in this amazing get-up at the moment. I go through periods of time where I'm on a health journey myself, and I'm got just the one ab, but I'm very proud of it. And I'm a little bit flatter than I used to be.
Yeah.
But it's incredible, and you've seen this in recent days with my post-surgery bloat. I can literally look a couple of months pregnant on any given day.
Yeah.
And it can be even before I have a meal. It's particularly worse after I eat. But your stomach just goes rock hard and it grows.
Yeah.
Like I'm a size 10 but still own size 14 gym tights.
Yeah.
Because I actually just don't know what I'm going to wake up and be. And then fatigue, lower back pain's a big one, because obviously with that cramping, your whole pelvic floor is in a bit of turmoil. Infertility is a symptom. So I actually found out as well from research, a lot of women discover they have endometriosis when they're in a relationship, they're trying to fall pregnant, they wonder why they can't, or they might have experienced a few miscarriages. You go in for a D&C and they investigate, and a lot of the time they find endometriosis. And then obviously pain outside your cycle. So you've got horrific periods, but then you'll still be in pain the other 20 odd days of the month.
Yeah. Why are so many girls told that severe pain is just part of being a woman?
Periods are meant to hurt. It's part of being a woman. Take Panadol, get on the pill. I'd love to know why that's the norm. I suppose it's just the stigma that being a woman's kind of brought with it, and we're cyclical beings. But I don't think it's fair that that's what pain's part of being a woman. Why?
Yeah.
Is it?
I mean,
childbirth hurts, and we can only do that. But
I think you know, in history, it's been a bit like, suck it up, that's just what women have to deal with, you know, same with childbirth, all that sort of stuff. But I think it's becoming more of a talked about topic now, and, you know, some workplaces have those days where you can actually have like a sick day for having your period.
Yes, government now have introduced for their workers, if you're a public servant, you actually have period leave.
Yeah, which I think that's a very, very small step and probably should have happened a long time ago.
In all industries.
Yeah, exactly. I think it's a small step in the right direction, but we need to get there a little bit quicker because
the research isn't keeping up. We need the grace to be dealing with it.
Exactly. Yeah. When does period pain cross the line from uncomfortable to medically concerning? Like, when should we...
When is it kind of time to go to the GP? Again, this is what's so tough is pain is subjective.
Yes.
As you mentioned last episode, some people feel pain a bit stronger than others, and fine, you're allowed to. There's actually no right or wrong in this. I think that's the first thing I really want to note. I think obviously for me, just the constant exhaustion, obviously fainting, peers at school weren't passing out from their period. I think as well, as you get older, things like sex, like I'm in my 20s, it shouldn't be taboo, but it just felt really isolating, like why would it hurt?
Yeah.
You know, is it them, is it me? It's not hard to do wrong. But that's all the things that go through your mind. So I think just when daily life is impacted, and I don't mean you've got a cramp, got to take a Panadol, but you're on the bus and you get to school, you do the day at school, you come home, have a Panadol, go to bed with a heat pack. I'm not saying that.
Yeah.
I'm saying you're in bed 10 days a month.
Yeah.
You're fatigued, heavy bleeding, low iron.
Yeah.
That kind of life-altering stuff.
Yeah, when it's actually
impactful,
preventing you from living your daily life.
I think start your journey. And I think be educated. We'll go into this when we talk about patient advocacy. But there's a bit of fake it till you make it on both sides, I think. And I think if you go in there with the confidence of, I know what endometriosis is.
Yeah.
I know what my symptoms are. I know my pain is real. If you're asking your doctor for a referral to explore that, they're not going to say no.
Yeah.
But if you leave the floor open, you're going to be ruling a lot of things out, which fine. I think a process of elimination should still take place because you never know.
Yeah.
But my gosh, I reckon I could have had a diagnosis 5 years earlier.
Absolutely.
And who knows, would I have ever gotten a stage 4? Would I have been confronted with infertility issues?
Yeah.
Maybe not. Hindsight's a wonderful thing and we'll never know. But as soon as it's life impacting, make that appointment and go in armed with a bit of Dr. Google.
Yeah, 100%. What are some of the less...
I'm drugged, so I've got an excuse. It's like osmosis.
What are some of the less talked about symptoms, like bowel, bladder, or back pain, that people may not realise are linked to endo? I think we've brushed a little bit on this.
We've brushed on that, and I think to just answer it short and sweet is because all those things can mean things on their own. They can mean things with other conditions. Like, of course, they're going to test me for bowel cancer.
Yes.
I'm bleeding from the bowel.
Yeah.
Like, no one's done anything wrong in my journey. It's just taken a hell of a long time to get to the end point.
Yes.
But I just think because things can be dismissed for other ailments, of course, I'm not going to think constipation and a bit of a sore back is endometriosis.
And again, like, I've had perfectly normal periods my entire life, and my periods come with back pain. So, you know,
part of being a woman, it's that line again, isn't it? So,
you know, some of those symptoms, can be for other things.
And I've
maybe
had my
I've just hurt my back.
Yeah, I've had my back cut open. I had a
Yeah.
spinal cord stimulator in there for years.
Yeah.
Yeah, my back's pretty sore.
Exactly. Yeah. Yes, exactly. Why is endometriosis still so frequently dismissed by medical professionals?
I think it's just lack of knowing. And I think, you know, even when I found my doctor up here, my OBGYN up here, I learned that even a lot of, you know, obstetricians, even though that's their region, a lot of the time they might not even choose to excise endo. Like you almost have to find endometriosis specialists so that, you know, you're not stitched up with an ablation or, you know, there's all this stuff in the news about that Melbourne doctor at the moment that was removing uterus and ovaries and when there was no signs of any endometriosis anyway, but, you know, they're in pain, so we'll take it out and cause them more pain.
Yeah.
Makes so much sense, mate, honestly. But, like, there's just, like, and even, like, again, my GP, the pill.
Yeah.
If you've got bad period-like symptoms, the pill.
Yeah.
Contraception. So I just don't think there's not enough out there. And as I said, 1 in 7, I'm going to put money on more.
Yeah,
it just seems way too common for us to have no awareness.
Because like you said, some women don't get it
away.
diagnosed until they start trying for kids. And then they're like, oh, that's why.
And it's like, I think it's something like that 1 in 7's diagnosed by the time they turn 44.
Yeah.
So it would be in those childbearing years that they're really struggling, but they've had painful periods, potential. And, like, can I just flag as well? Endo doesn't even necessarily need to cause a hell of a lot of pain for you to have it either.
Yeah.
It's all varying because you can have superficial endometriosis where it's, you know, surface level.
Yeah.
And again, we'll talk more about the stages when we dive more into it. But, you know, like, you could almost have no symptoms, have stage 4.
Yeah.
Like, everyone is so different. You could have stage 1 and have horrific symptoms. So I think it's like, again, even pain's not a great measure of whether or not you have endometriosis, because, like, just who knows until you're in there. And again, a GP can't cut you open on a random Wednesday in your half an hour appointment.
No.
You also need the money to then go see that OBGYN to be cut open on a random Wednesday.
Actually, that's a valid point. There would be a lot of people that cannot afford the medical care to dive into.
I know Albo's just announced some funding for some like women's clinics and pelvic pain specialists and whatnot, and that's amazing because it does open that door for those few more women to gain support. But again, it's like, how do you get in front of those people?
Yeah.
You need a GP to back you that there's something beyond a bad period.
Exactly.
To get that referral.
Yeah.